Hi, everyone, and thank you so much for joining us for the Coalition for Dental Care's first webinar, Who's Smiling Now? Access to Dental Care.
Who's Smiling Now? Access to Dental Care.
Everyone maybe disconnect from your YouTube. Great, okay. Sorry, I was getting a bit of feedback there. So we have our first webinar tonight, Who's Smiling Now? Access to Dental Care in Canada in the Era of COVID-19. My name is Georgina, and I'm a fourth-year dental student at McGill, and I'm also one of the founding members of the Coalition for Dental Care. This evening, we are very excited to speak with two awesome dental public health specialists, Dr. Allison and Dr. Quinones. Thank you both so much for joining us tonight. First, I will briefly introduce our two panelists. So Dr. Allison is a dentist trained in the fields of oral surgery and dental public health. Dr. Allison's particular area of research is understanding barriers to accessing dental care and how to overcome them, including training dental and other healthcare professionals in ways that help improve access to dental care. He also aims to help translate evidence into action through participation in a number of organizations whose goals aim to improve education, research health, healthcare, and health policy. He does this through his position as president of the Canadian Academy of Health Sciences and his involvement with the Association of Canadian Faculties of Dentistry and the Canadian Institutes of Health Research. We know Dr. Allison very well at McGill, as he was our dentistry faculty's former dean. Thank you so much for joining us tonight, Dr. Allison. Dr. Quinones. Oh, sorry.
Sorry, it's a pleasure.
Thank you. Dr. Quinones is a dental public health specialist, associate professor, and program director of the Graduate Program in Dental Public Health at University of Toronto. Dr. Quinones' research centers on the politics and economics of dentistry, with a specific focus on health and social equity. He regularly consults with government and non-governmental agencies on issues of dental care policy. He is the editor of the Ontario Dentist, the Ontario Dental Association's professional journal, past chair of the Canadian Dental Association's Committee on Clinical and Scientific Affairs, past president of the Canadian Association of Public Health Dentistry, and president of the Canadian Dental Specialties Association. Thank you, Dr. Quinones, for joining us tonight.
Thank you.
So first, we will have a brief presentation from Dr. Brandon Doucette about the current state of dental care in Canada. Dr. Doucette is the founder of the Coalition for Dental Care, and he graduated from Dalhousie Dentistry and is now practicing in rural Newfoundland. So the mic is all yours, Dr. Doucette.
Thank you. Perfect. So as Georgina's mentioned, my name is Brandon Doucette. I'm a dentist that is practicing in Newfoundland, and I'm just going to give you a brief introduction to the current state of access to dental care in Canada. So in its most simple way I can put it, dental care in Canada was not included in our universal healthcare system. As a result, dental care in Canada more closely resembles a private American-style healthcare system in which people rely on private insurance and out-of-pocket payments in order to access services. As a result of this, there's many inequities that people face accessing services, as people who can pay for these services can get the services readily, whereas people who cannot afford the services do not. So what does dental spending in Canada look like? In 2015, Canadians spent $13.6 billion on dental care. This pie chart that I'm showing you breaks down this spending. So as you can see with the pink and the red pieces of the pie, this is private dental spending, which is private insurance, which is work-related dental insurance, and out-of-pocket spending. And what we see is that is the overwhelming majority of dental spending at about 94%, whereas only a meager 6% is spending on government programs. And that's a very low number when it comes to government spending on dental care. If we're comparing this number to other developed countries, it's actually the second lowest level, even lower than the United States. So what are some of the consequences of structuring dental care this way? So some of the consequences are that over 1 in 3 Canadians lack any form of dental insurance, which is critical for people to actually access these services. And about 1 in 5 Canadians, or 6.8 million Canadians, avoid the dentist each year due to financial constraints. And when people neglect dental care, you see other statistics like 1.8 million Canadians are unable to chew. And I think that these numbers highlight that it's not just the odd person falling through the cracks in our dental care system. The way things are structured, there are large swaths of the population that are left out of our system systematically. And that's really what the Coalition for Dental Care is trying to fix. So other consequences of us having a private dental care system is that people have to neglect care. So people avoid simple things like getting cleanings or having fillings when cavities are small because they can't afford it. People need to ration the money they spend on dental care towards emergencies and dealing with pain. Oftentimes people actually have to live with chronic pain and infection. And these problems help perpetuate the cycle of poverty, as it's really difficult to obtain employment when you have missing front teeth or you have visible decay on your front teeth. Also, you could imagine it's very difficult to focus in school or work while living with chronic dental pain, especially considering how difficult it is to sleep when you have a toothache. And when the pain becomes unbearable, many end up having to pay for dental care by credit card. And say if you have a cavity on a front tooth and you need a root canal and then even a filling, not a crown, but just a filling, that can cost, $700 or so, which for many people is more than they pay for rent. And it's out of reach. So people who have to neglect dental care because they can't afford it have to deal with the consequences of poor oral health because they can't afford to get treated. And one of the consequences of poor oral health is its effects on our overall health. This is a good summary from the Canadian Association of Emergency Physicians, which shows which general health conditions may be caused or worsened by poor oral health, and people who can't afford dental care have to suffer with these consequences because they don't have the ability to pay for care. So one of the things I think some of you may be wondering is, well, if people can't afford to go to the dentist, where do they go? And what we find is that many people end up at their physician's office for dental pain. So a study from the Ontario Oral Health Alliance found that in 2014, Ontario's doctor's offices were visited every 3 minutes and emergency departments every 9 minutes by patients seeking treatment for dental pain. And this costs taxpayers a minimum of $38 million per year. Now, this is something when people go to their doctor for dental pain, oftentimes they're given an antibiotic or pain medication, leaving the underlying infection to actually still require treatment, as physicians aren't trained to perform root canals or extract teeth. So this is a big waste of resources, really. I mean, this money should be going towards getting people to actually go to the dentist. And I'm talking about this from an economic standpoint, but let's also keep in mind that this associated with these numbers are people who are suffering, people who live in pain, who lose out on sleep, who have anxiety because, they can't afford to get the necessary care. So one of the things I wanted to focus on here is these problems I've described thus far, they're getting worse. The number of people without dental insurance is rising. So many older people are retiring. They're retiring in large numbers and losing their work-related dental insurance. And many younger people are working in what's called the gig economy, which provides precarious employment in which benefits like dental insurance aren't tied to their labor. So we're seeing, even before the pandemic, a large rise in the number of people without dental insurance. And now with the COVID-19 pandemic and its associated economic downturn, we're seeing this problem become even worse because people are losing employment and working reduced to no paid hours. So when people lose employment, they're losing their work-related dental insurance, and people working reduced to no paid hours results in less income to pay for these services. So what this means is more people are suffering. And these are problems that require drastic attention in order to change course. So the takeaway from what I've spoken about so far is that dental care in Canada was not included in our Medicare system. As a result, people rely on work-related insurance and out-of-pocket payments to access care. The inability to access dental care results in significant suffering from people and also leads to inefficiencies within our healthcare system. And also, only 2/3 of Canadians have dental insurance, keeping in mind the number of uninsured is rising. So I'm going to briefly talk about some of the solutions in which the Coalition for Dental Care is advocating for before we open the discussion up to Georgina and the panelists. So one of the solutions is universal dental care, which is integrating dental care into our Medicare system by the provincial governments in partnership with the federal government, providing dental insurance to 100% of Canadians, so guaranteeing it as a right. There are many cost savings to a plan like this. For one, we're removing the profit incentive from medically necessary dental care, dental insurance. We also have some creative measures like the government can buy dental supplies and equipment in bulk, and with that, they can negotiate lower prices as they're buying them in bulk. But there's also other ways in which there's cost savings because people can there's less dental neglect amongst the population as people can seek treatment earlier. People are healthier as they're not neglecting dental care as much as I've already explained. And also people can go to their dentist rather than going to their physician for dental pain. So there's many benefits to a universal dental care system. One of the things that we at Coalition for Dental Care feel is important, that not only should people have dental insurance, they should also have access to an oral health professional to actually help them access care. And that's where I'm going to get into our final point here, which is dental therapists. These are mid-level dental providers, which perform simple dental procedures like fillings, extractions of primary teeth. They provide high quality dental work, the same level as dentists at a fraction of the costs. They operate in many countries around the world. I believe the number is 54 countries around the world. And one of the most well-known examples is the Children's Dental Program in New Zealand, which has been around for almost a century now, where dental therapists actually perform dental work on children in the schools. And this is a highly successful program, and it's actually a program that inspired a program here in Canada, in Saskatchewan in the 1970s and 80s, which in its heyday was wildly successful and was very helpful in ensuring all children had access to dental care in Canada. So we at Coalition for Dental Care think that dental therapists should work in areas in which dentists historically have been unwilling to go in large enough numbers. So most notably, rural and indigenous communities, schools, and prisons. So with this brief introduction that I've spoken of so far, I'm going to turn the floor over to Georgina. And yes, thank you.
Thank you. Thank you, Brandon. That was great. Great overview of the current state of dental care in Canada. Now we'll begin our discussion with our panelists. So our first question to both of you is a bit of a personal question. Can you recall an experience or a moment that drew you to the field of research and education regarding dental public health and access to dental care? I'd like to hear from you, Dr. Quinones, first.
So there wasn't necessarily any given moment or particular moment. You know, throughout my dental school education, I very quickly realized that I was a little bit more academic oriented, meaning I knew I was going to move in that direction. But there is one moment that really sticks out for me, which is in my second year or third year, pardon me, of dental school. I had the opportunity to go to a First Nations community very close to Winnipeg, where I went to dental school. And that experience sort of just opened my eyes to much more serious realities that we were being exposed to, at least at that stage. Over time, it became very clear that people that were visiting our dental faculty were also in serious need. But just to sort of see that level of economic and social marginalization really struck me and sort of solidified for me the idea that, yeah, this is sort of the direction that I want to take.
Thank you, Dr. Quinones. And Dr. Allison, what about you?
So my apologies to McGill students if you've already heard this story, but it really goes back to when I was trained originally, as I think you mentioned, in the UK, and I was trained as an oral surgeon in the UK. And when I was a resident in oral surgery, I was resident for about 5 years before I finished my exams and moved to public health. But as I was going through that, I was one of the, as we all know, one of the most common procedures that oral surgeons do is removing wisdom teeth. And it always struck me as strange that I would have people like your age, Georgina, and many of the listeners, the students listening, who would come in who were very healthy. They had nothing wrong with them. And someone had said to them, a dentist had said to them, you need your wisdom teeth out. And us being oral surgeons and me doing what I was told by my boss, I would take out wisdom teeth without thinking about it too much. They were there and they were meant to come out, so they came out. And then the healthy young person would leave with a face the size of a football, and they would have a lot of pain, commonly, not all the time, of course, but a lot of pain and swelling for a week or so. And then occasionally, very occasionally, there would be someone with more long-term effects. And it always struck me as a very strange thing to be doing to people. And I would asking myself questions about this. And this was in the 80s, so it was before really the period of when evidence-based healthcare, medicine, dentistry, etc., was à la mode. And then, so I was already thinking about that. And then one of the final nails in the coffin was when a person came in, a man who was in his mid-50s with who was healthy. He needed a few teeth out, and he came into our hospital clinic, and the boss there said, so how do you want to do this? Do you want to go local anesthetic, or you want a general anesthetic? It was a bit like, I would say in England, Smarties, but here I guess it's M&Ms. Which color M&M do you want, a blue one or a red one? Local anesthetic, general anesthetic, and the guy said, "Oh, I don't like pain and I don't like drills and stuff. Let's put me to sleep. I'll have a general anesthetic." And this was really 4 relatively straightforward teeth to extract. It wasn't that complicated. A few weeks later, he came in, and he was put to sleep. He had to have nasal intubation, as is the norm. And unfortunately, as can happen sometimes, he started bleeding extensively from his nose. And it got to the point where the anesthetist could not intubate him. His laryngeal, his vocal cords basically went into spasm and blocked his airway. And she couldn't intubate him. She'd paralyzed him, as is the normal way, and so he had a heart attack and he died. And that, what I'm talking about, the common thread of this is what I would call iatrogenesis. That was towards the end of my experiences as an oral surgeon, and that was kind of the nail in the coffin, literally, so to speak. And I said, I don't want to do this anymore. I'm going to look for an alternative. And I've had a friend who was working in the field of public health, and I went into that, and I studied in a program in London, which is an absolutely amazing program that really sort of opened my eyes on many different things. So that's my personal tale.
Thank you for sharing, Dr. Allison. So my next question, Brandon touched a little bit on this subject, but how have you guys noticed that the COVID-19 pandemic has highlighted the inequities around access to dental care in Canada? So we'll start off with you, Dr. Allison.
Well, so let's just be clear. Since the beginning of this pandemic, I've been sat in this office for 6 months, and I've hardly moved away. So I'm not. I think you have actually, Georgina. You've got more direct awareness and experience of seeing how things have been more difficult in clinical settings. So I can't speak to the direct clinical effects. Of course, I'm aware of them. I've been reading about them. I've been talking to lots of people about them. But it's very clear, having closed down dental offices for 2 or 3 months and then slowly opening them up, it's created all sorts of problems for dental offices, dental schools, dental clinics, hospital clinics, all sorts of healthcare settings. And that creates increased costs, and that means increased costs for the dentist and the dental office. Many of those increased costs are passed on to patients. Many patients are worried about going to see any healthcare provider, but particularly dentists, as we all know. It's a very intimate situation you find yourself in when you're going to see the dentist. So there are people with healthcare problems who, would otherwise be going to see the dentist or not. So I think there are many ways in which it's manifesting itself, both in terms of cost, in terms of fear, on both sides. I've been learning about how dentists understandably are afraid for themselves and for their staff and for their families. So I think there's multiple levels of this which are creating problems of access to care through the pandemic.
Thank you. Dr. Quinones, do you have anything to add to this?
Yeah, so I agree with everything Paul has said, and I just want to sort of pick up on what he said, that he's been sitting in his office, sort of working. I am, I'm sitting either upstairs in my home or in my kitchen here working. But I think what's important is that we both continue to be very comfortable, collect our full salary as professors at a university, and get to, talk a lot about how other people suffer. And I think that really, it's hopefully it's useful to anybody who's willing to listen, and we're hopefully helping in whatever way we can. But the reality is that it points to a state of systemic unfairness that exists in our society that ultimately results in the worse off becoming worse off, which from an equity perspective is kind of like the absolute worst thing one can do. So when you dovetail increased costs of delivering dental care, the inability to get to a dental appointment because you have to take care of kids because they're not in school. Maybe you're collecting CERB, you're lucky enough to collect CERB, or maybe you're not lucky enough and you're still having to work, a job that puts you at greater risk for COVID-19. These things just compound and result in making life worse for people that we should be trying to make life better for. So ultimately you're left off with a worsening or making more acute the dynamics that Brandon has discussed earlier on. So to me, that's really how I like to describe to people the challenges that we're potentially experiencing moving forward.
Thank you for the insight, Dr. Quinones.
If I may add, I think we've been hearing a lot how some at the beginning people were saying that this may be a leveler, if you want, how many people would be. We were all in the same situation facing this pandemic, but what has become increasingly clear is that there are increasing inequalities between different groups, whether it between men and women, whether it between people with different sorts of jobs, that have people that have to go to work rather than people like Carlos and myself who can stay working at home and all that sort of thing. So it really appears to be exacerbating inequalities rather than leveling.
That's a very good point. Thank you, Dr. Allison. Moving on to our next question. I'm sure everyone, or you guys have definitely read this paper. There was a recent study published by Thomas Christopher Lang of the University of Calgary School of Public Policy, which estimates the cost of a universal dental care system at about $730 per person. What are your thoughts on this figure and what variables could change this figure? So we'll start off by asking Dr. Quinones.
So I think that report out of the School of Public Policy at University of Calgary is incredibly timely and is much needed information for us to estimate the costs. I do have some sort of methodological challenges, I wouldn't call them concerns, because I think he and his team did an incredible job. But my point is this: $730 or some odd dollars fits into what one would expect when you average out all costs in current public programs. So here in Ontario, if you look at the costs per person covered, you end up in and around that area. So that number, to me, there's some face validity to that number based on some of the average costs that I see for publicly insured patients, at least here in Ontario. Probably varies across the provinces, of course, but it seems to be in the ballpark. The thing that might impact that, and this is probably more a concern than it is a methodological sort of bone to pick for me, but the concern is that that research group modeled services that we probably would not include in a publicly insured dental care basket. And I think this is a very, very important point. We need to figure out where there's sort of value for money in dental care, like what actually has therapeutic benefit and what should we pay for from the public purse. And I think that would probably make that estimate a bit more precise, because right now we pay for a lot of dental care that if, to pay for it out of private funding is perfectly fine. I mean, if you want to get veneers, if you want to get teeth straightened, so on and so forth, that's great. But the minute you start spending taxpayers' money, I think we have to be a bit more prudent in what it is that we spend money on. So I think a major issue, and what would change that cost estimate, is if we actually zeroed in a little bit more on what is appropriate in the context of public funding.
Great, thank you. And I'd be curious to hear if Dr. Allison, you have anything to add to that.
Sure. I mean, I think that the most important thing, as Carlos said at the beginning of his comments, is that it's very timely. It's really good to have a very well researched, good piece of good publication like this put out in a public place at this time. As I'm sure you're aware, and many of the watchers, listeners are aware, the issue of dental care and public dental care, or universal dental care, or whatever phrase you want to use, is becoming more and more of a subject. We know that the politicians are beginning to listen to this as an issue, and so to have something like this out there, which estimates costs, because politicians understandably will say, well, okay, maybe we do need this, but how much is it going to cost? And we haven't had until this point very much data about how much it costs. So I think just the fact that it's been put out there, it raises the level, it raises the debate. People start asking about this. Oh, you've read this exactly as you're doing. What do you think? And so it means that, you know, it's not because it's right to suggest one thing or wrong to suggest another. It's more that it's raising the level of debate. So I think that's fantastic. And then, you know, as Carlos was saying again, in terms of the costs, there are many, many different variables that you can bring into it. But the most important thing is, I agree with him 100%, is you have to consider what is effective for people. And there are many forms of dental care that are provided, just as there is true in medical care. Dental care is no better or worse than general medical and healthcare. But there are lots of forms of care that are provided which really are not very effective. They're not supported by evidence. And I think if we were in this position over the next few years to actually engage in a good debate about what should be in a basket for universal healthcare, gives us a fantastic opportunity to really think and look at the research to say, okay, this form of therapy is effective for this group of people, and yes, it should be in a basket because we figure that's a priority area. But this form of therapy is really, there's no evidence to support it, and we don't think at this stage anyway it should be included in the basket. So there's all sorts of different therapies, and effectiveness has to be part of choosing what should be in the basket of care. And then you get into, there's all sorts of other ways of doing it, about what sort of things, like as Brandon was saying earlier on, who's the workforce that's doing this? I think, of course, dentists will be at the heart of it, but so will dental hygienists, and maybe dental therapy will come back into it. But there's also nurses, pediatricians, geriatricians, all sorts of family physicians, all sorts of other healthcare providers. That there are many forms of therapy which are really very straightforward that could be provided by a whole range of healthcare providers. And then there's the whole issue about where is it placed, where's the care occurring. There's issues about how do you compensate people. Do you compensate people by acts, or you compensate people by salary, or you compensate people using other approaches? So there are many other variables one can think about in terms of reducing costs, which again, as Carlos said, if we're talking about going into the public sector using taxpayers' money, that is a very important question to ask, and any politician should be asking that. What's the best bang for the buck? So there you go.
Those are great points. Thank you, Dr. Allison. Now I have a little bit of a different direction. So how can dental students, researchers, and practicing dentists help improve access to dental care? So such as, what are some short and long-term goals that we can pursue to achieve perhaps a universal dental care system? We'll start by asking Dr. Allison about this question. Okay,
so I mean, when you're talking about research, I'll get back to students in a few minutes. There's a lot of research out there which is already documented very well, not necessarily in Canada, but certainly across the world, across developed countries, all sorts of barriers. So there are many things we know about the problems of access. But what we are we've got much less research on is the different ways of organizing the system in Canada, what could work best. So I think we need to do, one of the areas we were hearing about and discussing in recent years is we need to have economic evaluations of what the cost would be. So this study you just referred to is a very good contribution to that debate. But we need to have more debates around the different costs of things, because if we want to bring this to decision makers to move this forward, we need to address the questions that they have. So we need to go and ask politicians, and we need to go and ask the decision makers, if you were to consider bringing in universal dental care as part of universal healthcare, let's say, what would help persuade you of that? We ask them, and then we provide the information. So I think we have to be much more oriented towards what decision makers want, because this is a fundamentally political decision, and address their issues. In terms of the students, I think you guys are an amazing example of the sort of thing that you can be doing. I think it's really important. So I think across our schools in Canada, and I think many parts of the world, there's a lot of discussion within the schools around the problems of access to care. There's all sorts of community outreach type programs that are going on. But I think what really has to change, again, apologies to McGill students, you've heard me say this many times, it's all very well us doing these things in the schools, but we actually have to change the system, because, you're going to graduate. Hopefully the pandemic won't delay your graduation too long, but you're going to graduate next spring, Georgina. And then you go into a system which is completely dominated by the private sector and the private office model. And that, even if I'm assuming, judging by what you're doing, you're actually interested in other approaches, but you've got very little choice, and you have to create that. So we need people like yourselves working with us, working with the rest of the profession, to try and create new models for delivery of care, to help the dental profession who are really interested to get involved and to go and work in those new models of delivery of care.
Thank you, Dr. Allison. Dr. Quinones, do you have anything to add to that?
Yeah, from not so much the research side, from the policy side, I think precision of terms is very important. And I think it's important for students and for anybody to understand that when we talk about universal dental care, that more often than not, given the Canadian context and our values in healthcare, becomes conflated with including dental care in Canadian Medicare, which we'll leave whether that's good or bad on the table right now. But I just want people to understand that there are many more options in order to achieve the universal coverage of dental care. Right. So you can, Paul's from the UK. So you can look at the UK model, which has a national health system model, which is the equivalent, I guess, in very broad terms of including dental care and Medicare. But you just need to head a little bit west, and you go to Germany, for example, where most of the dental care is provided in a universal context. So they have universal coverage, but they specifically focus on employment-based benefits. So they achieve universal coverage for the population based on the employer-employee relationship, with additions at the margins to fill the gaps. Still very equitable. It's not a single payer model. It's a multi-payer model. You just move country to country, and those countries that have achieved universal coverage have done it in many different creative ways. And I think it's important for us to understand, in advancing this discussion, that it's not just about including dental care and Medicare, regardless of whether that presents as a positive option. So I think we need to expand our understanding of what is possible. As to what students can do, I'll echo Paul's comments that I think it's so incredibly wonderful that you guys are doing this, because I think ultimately, if I've learned anything over my time as a professor, is that ultimately the people that come behind you are more talented, more, smarter, the whole deal, right? So the future is brighter, and I think it's going to be part of this is upon you guys to sort of start a movement within the profession, which I've been incredibly, which I've advocated for a lot, that it's within us. In working in partnerships, like it was very nice to see the inclusion of dental therapy, but to reach out to the medical profession, to other professions, to understand how do we do this in a much broader context, which is the reality of modern healthcare. You can't do it alone, and to sort of bring dentistry into the 21st century kind of thing, and sort of do things in more strategic and more effective ways. So I think what you guys are doing here is laying the groundwork for probably a much richer discussion, because it's you guys that are going to be working in that system. And if you have no choices, as Paul said, that's not great. So the idea is to create some space, hollow out some space, and start creating the world you want to see. So kudos to you guys.
Thank you very much. I have one parting question. This one's just a quick one, but some argue that maintaining good oral health is a personal responsibility, and that providing free care to all would lead to people neglecting their teeth. What do you guys have to say about this statement? So we'll start off with you, Dr. Quinones.
So I've written a lot about this tension in oral healthcare policy, which is actually apparent in healthcare policy and is actually at the core of the debate that we're having right now around COVID-19 and around how to best move our society forward, which is this tension between individual or personal responsibility and social responsibility. I think anybody who argues that taking care of your teeth is solely a personal responsibility, or really sits there to a great extent, and that, sort of giving people quote unquote free dental care, which I think is not true. We're going to pay for it. Somebody's got to pay for it. There's nothing free about any of this. That somehow is going to result in people neglecting their teeth, I think it doesn't really understand the complexities of a variety of things. For example, what actually determines oral health? Probably not very appreciative of the realities of people that ultimately end up with things like toothaches and so on. It's much more complex than just somebody's willingness to engage oral hygiene habits. As well, I think it shows a general lack of understanding of how people behave when given quote unquote free dental care. I mean, you can go internationally and look at natural experiments that have occurred in Chile, in Thailand, in Turkey, where universal health coverage schemes were brought in that included dental care. And it did not result in huge losses to population oral health. In fact, what it did is that it tended to improve levels of health generally, but most importantly, it reduced the gap between the rich and poor in terms of their levels of oral health. So I think anybody who sort of argues that probably isn't paying attention to the literature and to the evidence and what really happens in those contexts.
Great points. Thank you very much. Dr. Allison, do you have anything to add to that?
I guess I would just say to someone who came up with that comment, so does that mean that so if we took heart care out of the, it's in the public system, so does that mean people don't look after their hearts, they don't look after their legs, they don't look after all the different parts of their body? I think it's a very short-sighted view of the world, and as Carlos has just referred to, it really ignores the incredibly strong evidence, and I know you know this, Georgina, and many of our people watching us know all about the social determinants and how important they are in determining how healthy we are. I was very lucky to be born into a middle-class family in a wealthy country and got a fantastic education. And so, there are so many things which have enabled me to become a healthy person. And there are so many other things that have resulted in people unfortunately being on the street, or being in war zones, or being a refugee, or being, you name it. There's so many different options, and that's not their fault. And brushing their teeth isn't going to change very much about that. So that's my observation, let's just say.
Thank you very much. Thank you for that very engaging and interesting discussion. Before we move on to the Q&A from our audience and from previously submitted questions, we're going to have just a quick presentation from Henry about how you can join the Coalition for Dental Care. Henry is a fourth-year dental student at McGill, in my class actually, and is one of the other founding members of the Coalition for Dental Care. So I'll hand the mic over to you, Henry.
Hi, so yeah, my name is Henry. We're going to give the speakers a little bit of a breather and a water break. And meanwhile, I'm going to introduce the Coalition Dental Care a little bit more. So who are we? Basically, we are healthcare students, professionals, researchers, and allies, and we're on a mission to ensure that all Canadians have access to preventative and essential dental care, regardless of their ability to pay. And if Dr. Doucette and our two speakers did not convince you why you should become involved, consider for a moment that 1.8 million Canadians are unable to chew due to untreated dental decay and pain, missing teeth, a lack of dentures, ill-fitting dentures, or illness such as Parkinson's. Or how about that there are approximately 19,000 day surgeries to treat early childhood caries in children under the age of 6 in Canadian hospitals every year. This makes dental surgery the most common surgical procedure requiring anesthesia in childhood. So if you want to learn more, become more involved, please like us and follow us on Facebook, Instagram, Twitter, share our posts, share our links, share our pages, and also continue to attend our events. Our next one is in mid-October, date to be determined, but you will see it in our social media pages. And most importantly, we need you. We need your energy, and we need you to advocate with us. So become a member. You can find our membership form in the video description below. Fill it out, and if we have enough interest from your school, city, region, or province, we're going to connect you, create a chapter, create more chapters, and take it from there. So please do all of the above. So now back to the questions and over to Ziad.
So I'll pass the mic over, as Henry said. Thank you, Henry. To Ziad. Ziad is a second-year dental student at McGill as well, who is also one of the founding members of the Coalition for Dental Care, and he has some questions from our audience.
Thank you, Georgina. So we got some very interesting questions. What I will do is that I'm going to ask each of you a question, and if the other professor wants to add anything, you can also do that. My first question would be to Dr. Allison. The question says, what policy solutions from the federal government should we look forward to?
I'm not sure why you're asking me that. Last I looked, I'm a McGill professor, not a federal politician, but there you go. I mean, I think for a start, I'll be very interested to see, as hopefully many of you know, there's the speech from the throne tomorrow. So last time this occurred, when was it, in November, December last year, we were very excited because dental care was actually mentioned. And then it was mentioned in the mandate letter to the health minister that she needed to be looking into so-called national dental care. And a parliamentary committee was set up, and they were beginning the process where they were actually going to look into that sort of thing. So I think, to be frank, what I really want to see, and I'm a pragmatic person, is that I want to see that despite the massive challenges that our government, federal government, provincial governments, and governments across the world are facing at the moment with the economics and health problems and multiple other problems with the pandemic, I would like to see the fact that dentistry stays where it was there. It doesn't disappear off the list of priorities to discuss. I think pharmacare is clearly the next priority for this particular government. Of course, there's a whole issue about whether will there be another election. I have no idea. Pharmacare seems to be a priority for them, and I think there will be other very interesting policies that emerge. Hopefully, there's a lot of talk about infant care, child care, and I think that's an incredibly important thing. And we may say to ourselves, well, that's not dental care, is it? But just following on the whole discussion we've been having around inequalities and about how important social determinants are, childcare, having good childcare is an incredibly important determinant of the health and well-being of the child and the mother in particular, but parents, And so I think it's not to be neglected. But clearly, I would also like to see that the continuing debate around dental care is in there, and that we're thinking we're able to keep bringing forward the discussion along the lines there's been with that policy paper out of Calgary, and all sorts of other options, so that the politicians are thinking about this and they're realizing that the inequalities may well be getting bigger, as we've said, because of the pandemic, and therefore dentistry needs to be one of those things they need to consider starting to cover better to help multiple families in problems.
Thank you, Dr. Allison, for a very interesting answer. My next question for Dr. Quinones. If dentistry becomes part of a universal healthcare, can we expect to see the same wait time and backlog as the general healthcare system?
So I think that's a very important question, and I would first like to dissuade anybody from thinking that we actually have long wait times generally in Canadian healthcare. You know, I have a brother who's a pediatric cardiac surgeon who has worked in a variety of health systems around the world, and he can tell you that he has no problems with whatever wait times exist in the Canadian system based on his experience in France, in the US, and in other countries. And his response is, listen, in Canada, if you have a serious problem, you are going to the front of the line. Like, there's no ifs, ands, or buts. Yeah, you hear about situations where people might be waiting a bit long and there might be negative outcomes, but in general, the system has a good job, does a good job at triaging people effectively. So I wanted to dispel the myth that somehow Canada suffers from some, you know, terrible wait times problem. It doesn't. You know, if you compare us internationally, depending on the surgery that you might need, yeah, you might be waiting a bit longer, but that's the trade-off we make to make sure that there's equity in our society in terms of equity of access and equity of use in healthcare. So the idea that somehow there would be huge wait lines because we're going to somehow cover dental care more broadly in a universal scheme, however that scheme may look, I think that really depends on how it's done, right? The devil's in the details here. If we don't do it right, there may be wait times. If we do it well, there shouldn't be wait times. You know, that somehow are punitive to people. And remember, the trade-off here is, do we want to privilege the needs or the demands of a relatively well-paid, comfortable, with minimal oral health care needs majority against the needs of the minority that have tremendous amounts or experience tremendous amounts of oral disease and the burdens, et cetera? It's that trade-off we're talking about. And if I personally have to wait a month or two before I go get my teeth cleaned, I'm very happy to give those 2 months. If the child who lives in a low-income household is able to get their caries addressed early on, so they don't end up under GA, getting treated, as was said earlier. So I'm very happy to forego that time, or to make that trade-off, right? So really, that's the trade-off we're talking about: more equity in Canadian society around this issue, or you wait a little bit longer. And to me, it's a pretty simple answer.
Thank you, Dr. Quinones, for this great answer. My next question is for Dr. Allison. How will so the question is like that. I think it's a bit open-ended, so you can choose where to go with it and answer the way you see it fit. How will a universal dental coverage affect dentists?
Yeah. I don't know. I don't know really the answer to that. So here's the thing. I think what it's very important to understand is that dentists, just like all health providers and all people, you know, the vast majority of people are trying to do the best in their job, and those of us who are in jobs that serve clientele, patients, or whatever, trying to do the best we can. And I think dentists across the country are trying to do the best they can to provide the best care they can, the best quality care they can. And most of them are providing good quality care. And I think they will continue to do that, and that they will adapt. If we do move into a universal dental care system of some sort, and as Carlos says, there's multiple ways of doing this, that doesn't mean to say that there won't be as well a private system. I find it very difficult to believe that we're going to impose a universal system and say you cannot have a private system. And I think many dentists will probably choose, in that sense, to stay in the private sector either completely or partly, depending upon what the arrangement is about whether you can do that or not. And there are many models across the world where people, as service providers, as doctors, dentists, etc., they work in both the public sector and the private sector. And that's, as far as I'm concerned, that's okay. The main thing is to be thinking about what service we want in the universal publicly paid system. And I think, coming back to a point I was trying to raise earlier on, I think if we bring in a new system, this will give more opportunities career-wise and more choices for many dentists. We've seen that corporate dentistry has become increasingly popular in Canada. And while I can't speak for the dentists that have gone into that system, what I've heard is that many are quite happy to go into a system where they can concentrate on providing dental care, and they can leave the financial and administrative business side of it to others. And I completely understand that. And I think there may be means of doing something similar, but in the public sector. When I was working in the UK, I used to work in a salaried system, working in hospitals. And I was quite happy doing what I was doing, getting a reasonable salary, and providing care, and was kept busy. And it was a different model of healthcare delivery. And I think if we've got different models of healthcare delivery, that will be quite attractive to some people. Won't be attractive to others. Some people may, I don't want that. Okay, that's fine. They carry on in the private sector.
If I could step in, Ziad, because I think there's some details here that are also important. I think many dentists say, oh, it's going to limit my freedom of choice in terms of what I'm able to do or where I'm able to work, et cetera. Oh, it's going to lower my income, things like this. But that's not necessarily the case, specifically because of what Paul has mentioned, that it will essentially provide more options for the public in terms of being able to access the care that they need. But in so doing, it will provide more opportunities for dentists to work in whatever environments we decide is important in designing a universal system of dental care. I think there's trade-offs here. So for example, I've been studying the German system quite a bit, so I'll speak to that. In Germany, dentist incomes are quite high. They're very competitive. In fact, on average, probably more than what Canadian dentists make. Because they're part of the healthcare system, they're much more integrated, not just in terms of the activities of the healthcare system, but they're much more integrated politically, meaning they have much greater decision-making power over their own affairs and much greater input into the affairs of the healthcare system writ large. That's not something to shake a stick at. That trade-off is very important for the health of the profession as a body. And so on and so forth. And last but not least, to make it real for dentists and for dental students, at least I can speak to what is happening here in Ontario. We're at the bottom of the line, if not even, or may not even be on the page in terms of being able to access personal protective equipment. We're rarely heard with respect to our concerns in a whole host of areas. So I'm not sure that's a good deal, that you get to be sort of this offshore island of Canadian healthcare, but have no authority when things get really serious, like in the context of COVID-19, and you're completely sidelined and marginalized. So I think we need to take a very close, hard look at sort of what we've done from a policy perspective over the last 50 to 60 years, and sort of understand that, you know, when things get serious like they are today, what has come home to roost, let's put it that way, in terms of our ability to be heard and get access to things like PPE and so on.
Thank you, Dr. Allison and Dr. Quinones. We have a question from the chat from Faris Yazji. He's saying, thank you a lot for your engaging answers. Do you think that a universal dental care should cover the aesthetic treatments too? And then he follows up with, in a sense, people with aesthetic problems might feel less confident to present publicly and hence affect other aspects of their health, mental, emotional, etc. What do you think about that? I'll ask this question to Dr. Quinones now, and if Dr. Allison wants to add anything after, you can do that too.
So that is actually a very complex and sort of like, I wish I had a clear answer, but there's not going to be a clear answer here. There's clearly aesthetic components to dentistry that have tremendous psychosocial implications, right? How do I feel? Can I get a job? You know, self-esteem, and so on and so forth. And we will need to take a close look in figuring out what should we pay for. And that is a really difficult question in that sort of problem set that we need to address. I will also say that it's very interesting that in some cases there's also an equity argument for funding something like orthodontics. Okay, so my previous supervisor, and I know worked with Paul quite closely, Dr. David Locker, he had a PhD student when I was doing my PhD named Dr. Shirugaju, and she was doing a PhD in orthodontics, as well as a PhD and a specialty in orthodontics. And she looked at self-esteem among high-income kids and low-income kids in terms of them receiving orthodontic care. And what happens is that if you measure self-esteem at the beginning, before they received orthodontic care, the high-income kids had high self-esteem, the low-income kids had lower self-esteem, okay? Once you gave them braces, the high-income kid maintained their level of self-esteem, but the low-income kid was leveled up to the level of the high-income kid. So there was an equity effect there with respect to orthodontic care. I'm not saying that that is the reason that we should fund orthodontic care, but just to use that as an example of how complex our considerations of what to fund will have to be in order to arrive at some best case scenarios in terms of providing a basket that tries to cover off as many of the issues that we might have to deal with, which isn't just about pain and infection, is also about, as the person asking the question might have an intuition, that there's clearly psychosocial things that we need to think about.
Thank you, Dr. Quinones. So this question is the last question, and I'm going to ask it for both of you. I'm going to start with Dr. Allison. What are some practical actions that a general dentist can take within their own practice to improve access to care for groups whose barriers have been exacerbated by COVID-19?
Very good question. And again, not being a practicing dentist, I find it very difficult to answer to that. I can come up with some sort of theoretical academic responses, but I think one of the most important things is to practicing dentists have their patients, and I'm sure the vast majority of practicing dentists will be aware of the problems that their patients are having, whether it be accessing dental care or because if they're aware of their jobs, the sort of thing. So it may, I would say, one of the best things to do is for us to be reaching out to our patients, in this case, to find out, if they've got problems and see how you could try and help them, try and try and maybe do some form of teledentistry consultation if they don't want to come in. Actually, have a conversation with them to see how they're feeling, and then try to find the best way to address any needs they have, recognizing the problems with infection control and all that sort of thing, and if they've got the diseases. So I think, talking with people and trying to understand their problems is an incredibly important thing to be doing, that a healthcare provider who's dealing with individual patients is a great thing to be doing. And beyond that, I think it's you get into the realm of being part of the discussion with the profession, through the association, through the licensing bodies around these issues, making sure that the licensing bodies and the associations are bringing these issues up. They're discussing them on fora like this. There are lots of fora like this going on, and asking the leadership to bring issues and problems that patients are having and that dentists are having to the attention of government and decision makers. Understanding that the decision makers are in incredibly difficult positions at the moment. It's like it's a no-win situation. We all know that the numbers are going up everywhere at the moment, and we're going to be the politicians are going to be put in really difficult situations where they may have to start closing things down again. And of course, it was already unpopular to start off with, but to a second time start closing down restaurants and shops and God knows what, it's so difficult for them. So I mean, yes, we need to raise our issues, but on the other hand, we also need to understand that our decision makers were in incredibly difficult situations.
Dr. Quinones, what do you think about that?
So yeah, I think running a dental practice right now is probably pretty stressful. And I have a lot of compassion for my colleagues who, as Paul said earlier, are trying to do the best they can, trying to figure out how they're going to pay for their own mortgages, how they're going to pay for their own children, and so on and so forth. But I just want to highlight the fact that in general terms, and these are generalities, so I'm sure there's always cases that fit here, but one of my colleagues said, luckily for dentists, they will have something to go back to at the end of all of this. There may be some people that have to go bankrupt and so on, but for the most part, people will have something to go back to. They will always have their profession, which is a tremendous opportunity, as I'm sure you as students realize that. No matter what happens, in general terms, the future is bright. And that might be hard to understand given the stress of this moment. But the reason I say that is to highlight the fact that there will be people that will not have something to go back to, that will continue to suffer, who have suffered. So if there is any way that you can give, and if there is any way that you can help by opening your door just a little bit wider and providing some pro bono care, or providing care at a lower cost, whatever is possible for you, to please try and do, because that is, after all, the reason we get to call ourselves professionals, healthcare professionals, and that is, the raison d'etre of being a self-regulated health professional. So, as best you can, just try and help. And if we do that en masse, imagine how much good we could do.
Thank you, Dr. Allison and Dr. Quinones. I'll pass it now to Georgina.
Thank you, Ziad. That was great. Those were some great questions that we got from our audience and great answers from our panelists. I just wanted to thank our viewers for tuning in. Don't forget to follow us on social media for future events and webinars. Hopefully in the next few years, live in-person events. And for the time being, we'll have more virtual events. And thank you as well to everyone who helped organize this and put this first webinar together. On behalf of myself, the Coalition for Dental Care, and I'm sure our viewers as well, we would like to extend a big thank you to Dr. Allison and Dr. Quinones for taking time to join us in this very interesting and highly inspiring conversation tonight. Thank you both very much. And we look forward to future discussions.
Thank you very much, Georgina, and to all of you for the invitation. Really appreciate it, and hope you enjoyed it.
Thank you.
Thank you. All right. Have a good evening.
Thank you. Ziad, is it off live?